present about the case of Metabical. And it is about pricing, packaging, and demand forecasting for a new weight loss drug. This is our contents, and first question is, how does Metabical compare to current weight loss options? First, it is the prescriptive drug, and its feature is it is dual layer and controlled release formulation. It targets the healthcare professionals who are suppliers, and it targets women who are knowledgeable about the importance of health. And also, it is the first medicine that approves from FDA. A second one is about the pros and cons of the demand forecasting method. Let's look at the first one. First method is targets the 50% of overweight individuals, and it assumes that 60% of test trials repurchase, and among them 20% will finish the Metabical. It is general promotion overall, but it is the worst income. Second one is first targets the 12% of overweight individuals, and test trials is same with the first one. And it is the best income at 5th year, but it is inconvenience for common user. Third method is targets the ideal target consumers who will complete the Metabical. And it also same with the same test trials, and the best income of total revenue. It has the best income of total revenue, and it is the specialization in the area, but it has huge damage when it is failed. And this is our forecasting demand of the first 5 years, and you can see the slide. The second one have highest demand at the 5 years. And third question is, what considerations should be taken into account when making decisions about the package count? What package size would you recommend? Metabical is low-dose formulation, so individuals should take this drug at the same time every day. And to see the result of weight loss, individuals should take this drug at least 12 weeks. For individuals to see results, much more packaging of drug is useful treatment, and this can reduce cost of packaging. But consumers can feel burdened because the price of drugs can be more expensive. Although total price would be almost same in the case of packaging for 12 weeks or separately 1 week times 12, most consumers feel more burden at first case. This burden can make demands lower, and also consumer can feel hard to manage whole 12 weeks drugs. This case, consumers have risks of missing of some drugs makes are unusable. To keep drugs with safe, it is easier to consumers that packaging with small size. What if packaging very small size like 1 week drugs? In this case, consumers can feel convenience, but cost can be increased. And also, consumers cannot feel weight loss well. So considering all, we think 4 weeks are best way for packaging. Cost of packaging 4 weeks of drugs might be much lower than first week, 1 week each. And also for consumer, they are just needs to buy drugs for 3 times, which means 3 months only. So this is not that hard to buy, lower burden. And number 4 question is about the suggesting pricing strategy. First strategy is benchmarks the price of hourly drugs. And second one is consider a rate of margin from other CSP companies' drug. And last one is concentrate on consumers who will take Metabarker program perfectly. And let's look at the advantage and disadvantage of each strategy. First strategy is very low price. So it targets a very large size, but margin is too low. And second one is most efficient strategy because it considers margin profit. It considers the rate of margin. So it is ambiguous and couldn't target exact one. So it is hard to gain feedback of results. And third one is the most profitable margin. It has most profitable margin, but this price is too expensive. So consequently, the target area is too small. So our recommendation is second price because it is the most safe selection. It is designed considering the rate of margin, so it can be easily to take the profit from the results. And the other strategies are too cheap and expensive. And let's go to the last question. Last question is impact of pricing decision on profitability and ROI. We figure out is calculating ROI of each pricing strategy. What is the ROI? ROI is the concept of an invest of some resource yielding a benefit to the investor. As a performance measure, it is used to evaluate the efficiency of an investment or to compare the efficiency of a number of different investments. First, we found out the total demand using demand forecasting. Based on the fact that US adult population was approximately 230 million and all scenarios used BMI between 12, 5, and 30, we got accumulative numbers of each scenario and combined it for total demand. Then using manufacturer gross margin, or each pricing, we figure out gross margin of each scenario, which is used for numerator of ROI. Then find out total cost of Metabarker and use it for denominator of ROI. Now we calculate ROI of each pricing and forecasting strategy like this. According to this result, we have to pick $150 price as second scenario, but we have to consider other conditions like competitors' price or other external things. If other company launches cheaper drug, the population that second scenario forecast can be wrong because it considers respondents were ready to immediately go to their healthcare provider to request a prescription. So we conclude that even though ROI of third scenario in $150 is lower than highest one, but it targets specific and ideal users and they expect to capture a higher present penetration of this ideal target. We think this is safer than highest one. That's why we choose $150 in scenario 3. Thank you for listening.